Contributions now, please. Margaret Greenwood.
Thank you, Mr Deputy Speaker. The proposed NHS payment scheme in this bill will in effect give private healthcare companies the opportunity to undercut NHS providers, and I believe that we'll then see healthcare that should be provided by the NHS increasingly being delivered by the private sector, money going into the pockets of shareholders instead of being spent on patient care. If that happens, NHS staff may well find themselves forced out of jobs that are currently on agenda for change rates of pay, NHS patients and NHS pensions and other terms and conditions, with only private sector jobs with potentially lesser paying conditions available for them to apply for if they wish to continue working in the health service. My amendments 54, 55 and 56, supported by the Royal College of Nursing, aim to ensure that the pay rates of agenda for change, pensions and other T's and C's of all eligible NHS staff are not undermined as a result of the adoption of the NHS payment scheme, and that all relevant trade unions and other organisations representing staff who work in the health and care sectors are consulted by NHS England on the likely impact of the proposed scheme. On hospital discharge, I have tabled Amendment 60, which would remove Clause 80 from the bill. The hospital discharge proposals are risky for patients and for staff, and the RCN said in their written evidence to the Bill Committee, quote, "In the context of current high vacancy rates across district and community nursing and poor understanding of workforce shortages across the health service, public funding and social care, chronic underfunding due to failure of the current service payment model to recognise community nursing, this legislation should not seek to demand a service delivery approach which transfers such disproportionate risk to nursing staff and patients." Now, as of May this year, 4 million patients, May last year, I should say, 2020, 4 million patients have been discharged, under discharge to assess, under the temporary measures of, as of May this year, under the temporary measures of the Coronavirus Act since 2020. I asked the government how many of those patients were readmitted within 30 days, and I was told by the government that they didn't hold the data. So in effect, they didn't know, and they hadn't got that information. Back in June of this year, the government told me that the National Health Services commissioned an independent evaluation of the implementation of the hospital discharge policy, which is currently underway. And that evaluation was due to report in autumn 2021, i.e. now. Yet, the NHS told me last week that the report containing the evaluation hasn't yet been finalised. It's therefore a matter of extreme concern that the government is pushing ahead with a policy that is risky to both patients and staff without properly understanding its clinical outcomes and in knowing that it's doing so. And so I would ask the Minister to withdraw Clause 80 from the bill. Thank you.